We are back. It's been a few weeks since you've seen us on the farm group, and we're excited to be live again and share with you today that to talk about Cushing's disease. So, hi, Dr. Alex. Nice to see you.
Hello, nice to see you too. And well, I cannot say nice to see everybody because I cannot see.
Can't see everybody. No, but it's nice to be back with the farm group. Yeah,
We have
yeah.
all our members. Nice welcome.
Yeah, and Happy New Year to everybody, because we haven't touched base since the beginning of December, I think it was the last time, or somewhere around there, before I hopped on a plane and flew to England.
Yeah.
So I'm back and you're back, and we're getting back in the saddle, as they say.
Kind of thing.
After
adventures.
Yes, many adventures. So let's see if I can successfully share my screen today. Ah, there we go. It worked. Hooray. So as we had posted yesterday and shared with you guys that we were going to talk about Cushing's disease and homeopathy. And this is a little different than what we have shared in the past. Most of the things that we've talked about in the past, we've given you a handful of remedies to address, but we really haven't gone into a chronic condition to this level. And we're seeing more of our clients are reaching out to us about the symptoms that go along with Cushing's disease and Cushing's disease. So we thought we would cover that today. So here goes nothing. So Alex, this was something that I was not aware of. I had never dealt with Cushing's when I had a horse, and it's been many years. But talk a little bit about what Cushing's is. You've got a lot of information here to share.
Well, Cushing's is actually not really a disease, it's more a syndrome. And the syndrome, as opposed as a disease, means that there are a lot of systems or a lot of organs that can be involved. And therefore, we like to call it a syndrome. And basically, it can affect the pituitary gland, and Cushing's is usually known as pituitary pars intermedia dysfunction. But basically, it can, if it is related to the pituitary gland, because later on we're going to see that it can be related to the adrenals. But if it is related to the pituitary gland, this gland is affected, and this gland and the hypothalamus are basically the boss. The pituitary is the boss of the endocrine system. So being the boss, it means that all the other hormonal systems are in a way regulated by the pituitary and hypothalamus, but mainly the pituitary. So this gland produces hormones which control in some way other endocrine glands of the body.
Endocrine, right. They send signals. They tell the other glands like what to do, how to operate, exactly. what should be happening in the body, right?
In the body. So the hypothalamus we have in the skin, it's close to the pituitary, and they are hand in hand.
And then the adrenals with people, and definitely with horses, are a really big deal when it comes to your hormones.
Yes. So basically, the Cushing syndrome can be this ACTH, which means adrenocorticotropic hormone, which is a very big name for something quite simple. So basically, Cushing syndrome can be dependent on this hormone or can be independent of this hormone. If it is dependent, which is the majority of the cases, and as statistics go, that between 80 to 85% of the cases are ACTH dependent. If it is independent, it's the minority of the cases,
Mhm.
and obviously it's 20 to 15% of the cases. So this hormone with a big name is produced by the pituitary gland that we just talked about, that is at the base, at the brain, and which in turn acts on the adrenal cortex. The adrenal cortex are two glands in the human body. They are like two little beanies, they have like almost a triangular shape that they sit on top of the kidneys. So the adrenal glands in the horse are located in the skin and just above the kidneys. And these glands are responsible for the production of cortisol. And cortisol is the stress hormone. So can we go back a little bit?
Yeah, of course. Sorry.
So the hypothalamus, that is that little part orange glued to the pituitary, the
Oh, here.
hypothalamus,
Yeah.
yeah, and the pituitary control and regulate the ACTH, which regulate the cortisol and the androgen production. So the androgen basically is a steroid. I will talk that. We'll talk about that a little bit later. So, again, the Cushing syndrome, we have the ACTH dependent, which is caused by a benign tumor located in the pituitary gland, which is the majority of the cases. And the ACTH independent, the minority, is caused by a tumor actually in the adrenal glands.
Okay, so two totally different locations.
Yeah, in the adrenal cortex. Next. So, independent of the location, if it is in the pituitary or in the adrenal cortex, these tumors will cause an overproduction of ACTH, which in turn will stimulate the adrenal glands to produce too much cortisol. And this, in a nutshell, is what is going to be responsible, or the culprit, for all the other symptoms we can see in the Cushing's syndrome. So cortisol is also known as the stress hormone, and it's not surprising that, our horses are afflicted by this condition, because horses are most of the time exposed to stressful situations. I mean, horses are under stress in the majority of riding schools, because if there are riding schools, are people that are not used to ride, and they will cause a kind of stress. They are in stables most of the time. I don't know, not so much in this country, but for instance, in Greece, the poor horses that are in riding schools, they do not have paddocks where they can really be a horse and behave like a horse. They spend most of their time in the stables and from the stable alone, which horses are not supposed to be alone. They live in groups. and they go from the stable into the arena. They walk right, they walk left, they trot right, they trot left, they canter
Sure.
right, canter
A lot of
left,
expectations.
back to the stables. So that
And
is also
here in the States, we have, you know, a lot of race horses.
and the races that was
Right,
going
whether they're jockey or
crazy.
sulky, and you know, again, put into stressful situations pretty much all the time. And many horses are their process is not honored. So if you are working a horse really hard, whether it's an animal that you use on the farm or it's an animal that you're trying to receive performance from, you know, racing and that sort of thing, and showing, they are not necessarily given the opportunity to cool down, to relax, to not be stressed before and after. They might be subject to some enhancement medication or drugs or what have you. So there is a lot of stress on these animals for sure. So let's talk about the signs of Cushing's. This is really fascinating. There was a lot more to this than what I had realized. So I'm so glad we've dug into this.
So there are a lot of symptoms that can pop out, and every horse is going to be different, and more than one will have to be what we call in homeopathy concomitant. So they can have a change in attitude with recurrent infections. You know, there are symptoms that are not related, but they tend to appear at the same time or over the same period of time. And these will be the telltale, you know, because there in Cushing syndrome, we really do not have, okay, he has a fever, so he has an infection. It's really difficult to pinpoint. So we need to be aware what are the possible symptoms that the horse can express. And if there is one or two or three at the same time, concomitant, then it's time to call the vet, to do tests, to see, to rule out the possibility of Cushing's. So the first one, and this is quite typical, is either the loss of seasonal hair, and the horse will shed too much, and or will have patches, bald patches along the coat, or exactly the opposite, what we call hypertrichosis. It will be too much accumulation of hair, again in kind of patches. If you go back to the page, to our first page, the first,
Yeah, here you can really
yeah,
see on this horse.
that it has problems in shedding, but it has patches of hypertrichosis as well. So this one actually it has both. It has too much shedding.
Excess. Yeah,
And
excess and patches.
exactly.
Yeah.
And so this is one of the main pointers. Another one is a change in attitude. A horse that has been very docile suddenly become quite cranky or quite aggressive, or vice versa. Recurrent infections. These again can be quite a lot of different. It can be, we're going to see later on, but it can be corneal ulcers, it can be laminitis, it can be hoof abscesses. We will see, but yes, recurrent infections is what you have to have in mind, not once, but when they start coming. Abnormal sweating, too much sweating, lethargy, laminitis as one of the recurrent infections, loss of top line muscle. So we will start to see almost a curvature where it should have been a concave and convex. So instead of a concave line, like a convex line, decreased performance, recurrent corneal ulcers. Another one is tendonitis, or the tendons and ligaments become very lax. So they have a tendency to luxations. Two rounded abdomen. Of course, there are certain breeds that is characteristic, especially in ponies, usually they have a rounded abdomen. But if you see a horse that usually is slim and suddenly becomes with a big belly, it's an alert sign. Polyuria, so this is when the horse pees too much. There is an increased output of urine. And of course, concomitant with this, it comes a lot of thirst. So usually they start drinking a lot and having an increased output of urine. Although the increased output of urine, it's easier to spot than the drinking a lot, because if the horses turn out in pasture, you're not going to see exactly, how much the horse is drinking. But if it is at night when he goes back to the stables, you can see, if the wood shavings or the hay is really soaked. Regional adiposity, again, these are like lumps of fat in just localized areas, like a big crest, or as we're going to see later on as well, they can develop on the supraorbital area, like big lumps on above the eyes. So bulging of the supraorbital fat, again, these are localized deposits of fat. Yeah. Sudden weight loss, and other examples of recurrent infections is sinusitis, dental diseases, and hoof abscesses. Of course, there are more, but these are the main ones.
And one of the things that brought this to our kind of focus this week was this particular case. This is a 30-year-old halflinger. I think she's 13 and a half hands. She has been owned by the same person for over 20 years, if I'm not mistaken. And she was diagnosed with Cushing's disease about 10 years ago. And the thing that brought it to their attention was too much hair. She did not shed her coat. So she looked like a woolly mammoth. And come spring, it wasn't falling off. And thankfully, the owner is really connected well with her vet and has somebody that visits her frequently. So this mare had a symptom picture. These are just a snapshot of some of the things that were shared with us. She's very affectionate. We're told that if you go near the stall, she's going to rub you all over with her head. She'll come right up and lean up against you. There is thirstlessness with this particular horse. She does not drink very much. She has very decaying and crumbling teeth. Earlier last year, I think they said the vet was looking at her teeth, examining them, looking to do the teeth float, and was able to pull a couple of teeth out with their hands without any trouble at all. And I guess she's ground her teeth down quite a bit, and that's just happened in the last couple of years. Again, the not shedding, the leonteric stool, the undigested hay was another indication for us. And then luxation. She had they had another farm animal from a neighbor's come into the property about a year ago. And it was quite aggressive. It was a very large hog, and it stressed out both of the horses. Their stalls have half doors, and she tried to leap out of her stall. And she made it about halfway and then managed to launch herself and come down on cement, and had some pretty serious luxation after that. So when we've had members ask us, can you do a write-up on a case so that we understand how you got to the remedy that you got to? And we don't do that very often. First of all, it's very time consuming. And secondly, with chronic cases, we need people to understand that there's a chronic component to this. So it's not about, okay, we came to this remedy and therefore this is the remedy for all of Cushing's. This is the remedy that matches this Haflinger mare. She is very affectionate, the decayed teeth, the looseness. She has free fecal water syndrome, which was actually what brought was the cause for the woman to contact us. And a variety of other things, but this gives you a snapshot of kind of how we got to the remedy pulsatilla. And she's just started on this week, so we're looking forward to hearing from her. And then last year, we had a case of this adorable mini gelding. So handsome. 16 years old, 5+ years of laminitis, very seasonal laminitis, especially in the spring. So that's going to be our big test in the next couple of months. And very pre-Cushing's. He has a lot of the symptoms and signs. And what's interesting is he's such a different creature from the Haflinger. He's very domineering, but he's really fearful. He's afraid of every little bump in the night. He's insulin resistant. He definitely has issues with weight gain. He's very sensitive to the weather changes. They've had a lot of laminitis, at least for the last 5 years or so. And they have seen him colic. He is on thyroid medication. He does have an increased ACTH result. And additionally, he is battling Lyme disease, which is really prevalent here in New England. It's almost impossible to have any kind of animal outside that doesn't struggle with Lyme disease. So that's another autoimmune that we have to pay very close attention to. And with his sensitivities came some vaccine reactions. So this little guy, he has been since June of last year. We've been working with him, and he's doing beautifully on Nux vomica.
Yeah.
And Alex, can you talk a little bit about that?
So the main reason why the owner of the Haflinger contacted us was because of the free fecal water. The main reason of this owner to contact us was because of the recurrent bouts of laminitis. So he came to us when it's almost
June.
It was June.
Yeah,
June, over 6 months. And we are thrilled because he never got any bout of laminitis since he started the treatment. And he has been turned out to pasture even, although
that was a really big deal, was because he was not allowed to go out to pasture because the grass was really an aggravation for him. And he did beautifully with the remedy so far.
So because he lives with another little pony, a miniature pony as well, and they are like, they're not brothers, but
they're about 10 years apart, actually.
Yeah, but they live like brothers. We know that he's very dictatorial, and he's the boss. the other poor horse that is older than him is bossed around like there is no tomorrow. So this is the
One of the keynotes.
repertorization that we came up, and Max Vomica touched everything, including his thyroid. He also had free fecal quite
And that
often.
actually came a little later. The free fecal came a little later in the season. And the owner did a lot of work with his diet. And between that and the remedy, and I think there was one other acute remedy that he had for the free fecal water, and he's responded beautifully to remedies, which is fantastic. I loved it. One of the last times we talked to her, I was looking at my notes last night, and she said, we asked how his personality was, if she had seen any difference between the two of them. And she said, oh, he's very Orbit-ish, which is his name. So he's still his same self, which is good, So one of the things that we really want to stress is that Cushing's disease really is a chronic condition. We could not have come to the understanding and the repertorizations that you saw without taking the full case of these animals and being able to follow along with them, which is another big piece of this. When we take a case of this nature, we will typically say, follow up with us in 2 weeks or 3 weeks or 4 weeks. And we're looking for a response to the remedy. And it's so vital that we get that feedback from the owner. And oftentimes, people will say, oh, I didn't see any changes. And then we start to go through the list. And very frequently, that's when the owners begin to realize, oh, these have been subtle, but there have been shifts, there have been changes. And with the mini, it's been great because we've been treating him since June. So we've really been able to see this remedy in action for him, and how he has transformed and how much better he is doing. So when you book an appointment with us, whether it's for Cushing's or some other chronic issue, a lot of people think, oh, well, I've only been dealing with this right now for a couple of weeks. But when we start to kind of tease out the case, that's when we see, right, Alex, that it's like, oh yeah, no, this has been going on for 4 or 5 years. Every spring this happens, or every time he eats too much of this or gets exposed to that, then we'll see symptoms. And that's when, we'll bring to your attention, this is really a chronic issue. So Alex, will you talk a little bit about homeopathy and the action that it has on chronic cases?
Well, the one point that I wanted to point to make people aware is that when you take a case, as you saw, and because it is a syndrome, if we had, let's say, the horse, the main problem of the horses was laminitis. The acute attacks of laminitis are not really an acute. This is a chronic situation of a miasmatic, of a miasm. So we need to take the whole case, not just the laminitis, because if we had repertorized just the laminitis and just looked at what remedy to give for this, then we would miss the chronic remedy. The chronic remedy needs to encompass the whole animal and needs to cover almost all the symptoms that the animal is expressing. And that's why you need a qualified homeopath. imagine that it is just recurrent tooth infections. Again, if you just repertorize the tooth infection, say, oh, is it the upper tooth or lower tooth, right side or left side? Oh, is it really painful or not so painful? That he can still chew or he cannot chew because the pain is so big. You might come to a remedy, and that remedy even help slightly or even deal with the acute, but it's not gonna address the root cause of the problem.
And that's where
So,
we call it palliating.
you
So
know, yeah.
it doesn't go deep enough.
It doesn't go deep enough. Of course, it's better to give an homeopathic remedy for an infection than an antibiotic.
If you can, yes, absolutely. And
I'm
you
not
still have to stay with the
disputing,
case if it's an infection, yes.
but a few months later, and sometimes a few weeks later, the same situation is going to come up. And it's going to be another tooth or even the same tooth, and again, another infection.
Right.
So the chronic remedy, it's going to, over the time, is going to make the acutes, which
Less.
are false acutes, because it's like a weed. What you see is the top, and you address the top. But if you do not address the roots, which is the chronic remedy, it's going to keep on popping up.
Right.
So the chronic remedy over a period of time is going to make either the acutes to be much more spaced out, or even if they are with the same frequency, they will be much less in intensity until they get totally resolved.
Right.
But we will be able to tell within 6 weeks to 2 months max that there has been a shift, even if the acute still comes up.
Right, because we're looking at the full picture. It may not be the layers, and you and I have talked about this before, where there are layers to a case. And you know, what's the top layer? Well, it might be the tooth infection at the moment, but you know, where are the underlying pieces? And by looking at the mind, by looking at the body, by looking at the energy of the animal, the force behind which these things appear for them, and where they manifest in the body is another piece of it, but also really important to know how they react and respond. Because just like us, if one of us gets a cold, we might just have it in our sinuses, and, you know, have a headache. If another person gets a cold, they might end up with an ear infection or a sore throat or, you know, something to that effect, but it could be the same virus. It's so important to understand the full picture of the client, the customer, the animal, etc., so that we can look at their constitution and recognize where their strengths are, where their weaknesses are, and how do we support that on the whole, because that's what homeopathy does. It supports the whole being. So the other piece to this today, Alex and I were chatting about this, and it actually came up in the group a week or so ago. Somebody had asked about an ebook, and I think at the time we let folks know that they could find it here. So Alex had written this homeopathic aid for horse owners and riders, and it's a 40-page guide on homeopathy with regard to horses and their owners. And it is available to download on our Linktree page. And it's the address is there for you. And I'll post it in the comments once the video goes into a recording. And if anybody has horses, this is a wonderful thing. If you know somebody that has horses, this is a wonderful thing to pass on. And if you come across something in the book that you want to talk about or you'd like us to discuss, please let us know. We would love to hear from you. We'd be really curious to have some feedback on it as well. And Alex did a beautiful job, beautiful job on this book.
Yeah, thank you.
Thanks for putting it out there. So thanks to everyone again for giving us the opportunity to share this information with you. We love doing our live broadcasts, and we have started putting these videos on YouTube. So if any of you are in an area where you only get to download things a certain, period of time or what have you, you don't have internet access all the time, please visit our YouTube page. It is youtube.com at Homeopathy United. And here's our contact information. We'd love to hear from you, work with you and your animals. We appreciate all of our members and everything that you've shared with us. And thank you, Dr. Alex, for all of that information. It was fantastic.
Thank you, Rebecca, for everything.
My pleasure. My pleasure. And we look forward to seeing you guys in 2 weeks. So it will be February 1st when we connect again.
Yes,
And
because
we hope
next Thursday it's gonna be on the
Skin Group.
presentation.
Yes, yes. And we hope some of you will join us over there as well. Thanks, everyone. Have a great day.
Bye.
Bye.
Bye. Bye bye.